Now we're going to go on to the cluneal nerve tensioning exercise and also the slacking, depending on how she responds. Here's how it's done. This is the nerve. Let's say here, have a seat facing that way. Now, all right, so this, guys, is my go-to exercise with low back pain, specifically with SI joint pain. Many of my students on my mentorship program, they've tried this and they fixed a lot of people with low back problems and SI joint pain. And they all say that they wish they knew this earlier. I wish that too, as well. So cluneal nerve, we're going to do the tensioning sequence. Now, for the tensioning, first we need, it was her left. So left leg is going to cross over the right. I would like to say, let's keep this hand under the knee. This one will stay on top of the ankle, like this. Now, so lengthen spine, keep lengthening your spine as you go into a full spinal slump. Make sure that get that upper back rounded. There. So full upper back rounded, chin to chest, just until she feels like a little stretch, left glute. She also fell down to her foot as well. And maybe something down to that SI joint. Now she's going to stay there. And now she's going to rotate from the lumbar spine to the left. So rotate, and you should feel a slight increase in stretch. Back to the middle. And again, back to the middle. Don't turn your head at all. Focus on moving from the lower back. You're trying to rotate from the lower back. That makes sense, right? Good. So this is very important, guys. You have to make sure that your patients are rotating from the lumbar spine. Try not to rotate the neck or the shoulders. And one more time. Rotate. Very good. You should feel that additional stretch down the hip, right? Okay, let's take it relax. Okay, so that's how we usually do the cluneal nerve tensioning. Full spinal slump, externally rotated hip inflection, and rotation toward. Now we're going to add more of a twist to it. She's going to stay in that forward bend. She's going to stay rotated to that left, but then she's going to do a lateral glide to the right. Let's try that again. Left leg over the right. From here, we have head down, full spinal slump. Push that chest back, lengthening the spine as well as you bend forward. Let's find that little 3 out of 10 tension down the hip. We don't need a lot of stretch here. Let's rotate it to the left. You feel that now a little bit more. Now, I want you to glide your body to the right. There, you should feel that a little bit more now. And back to the middle. Glide back to the middle. Stay a little more rotated to that left, right there, and glide that way, kind of like a diagonal glide. We got it now. You feel that? Yeah. Good. So she's doing spinal gliding. Very good. One more time. And glide, stay rotated to that left, and good. Perfect. Okay. Let's recheck. Let's actually go back into standing. Okay. Let me move this away. Let's reassess. Let's check the neck. Better or worse? Tighter, huh? Yeah. Okay. Let's see shoulders. Yeah, that got a little tighter. See the other one? I dare doing that toe touch. It got a little tighter. Okay. So, cluneal nerve tensioning, not for her, which is kind of rare sometimes, but it happens. So now we're going to slack it. See if that produces an even better result. This was the left. So we're going to have our bench this way. More back. How's that? All right. Let's go now seated, and I want you right over here. Yes. Okay. So for this one, you're going to be sitting at the edge of the chair. You don't have to have your whole leg off the chair, like your whole left butt off the chair. As long as you're able to bring the left leg back into extension. Right there. Okay, so now this is the exact opposite move of the cluneal nerve tense position. Now her hip is in extension. I'm going to, her leg is also into abduction, which is good. And also we need femoral internal rotation, which she's already here. Are we good? Okay. Right now, at the spine, we need spinal extension, including the cervical spine. So head back, the chest back. Very good. And now give me a rotation right there. This is the exact opposite position of cluneal nerve tensioning. The hip is an internal rotation, an abduction, and extension. The spine now is an extension and a rotation away from it. Because when we rotate toward, you're tensing the cluneal nerve. And I tell her to sit here in this position, also telling her to try and stay as relaxed as possible. Even though it's hard to maintain this position, but I want her to relax all the muscles down her left leg, everywhere in her body, and breathing. Are you okay? Gonna stay here for about 10 more seconds. I usually have people sit here for about a minute. But I first try about 30 seconds just to see my reassessment, how that went. Are you okay here? 5 more seconds. 5, 4, 3, 2, and 1. All right. You okay?
Yep.
You dizzy?
No.
All right. Let's stand back up. Let's reassess. Okay. All right. Let's see what the reassess everything again.
Oh, much better.
Yep.
Oh, yeah.
Okay. Yep. Forward touch. And we're back to where we were.
I couldn't do that before.
All
I
right.
couldn't get my nose down. Nose to knees, I couldn't.
Perfect.
Just the difference.
All right.
Oh,
So that was cluneal nerve slacking, right?
Slacking.
So I'm going to call you back again.
Okay.
Right. So let me take the floor.
Yep.
All right. So hopefully that, guys, that kind of gave you a little bit of thinking when it comes to how we address this cluneal nerve. So notice what happened. She did the tensioning sequence, but I have to reassess her because if I learn this as textbook, this is what you should always do for SI joint pain. Okay, great. But the person does it and gets worse. That tells me something. Maybe I need to do the exact opposite. I got to slack it. That cluneal nerve on Laura needed to calm down. It didn't need to be stretched even more because, as you guys can see, Laura's a very, very flexible person. That's one of the bad things about people that are very flexible is that they don't know their own limits and they always want to constantly keep using their range of motion. They want to constantly keep stretching over and over and over again. But the more they stretch, the more they hurt. And I know Laura quite a while. And I always find her stretching, not anymore, because I was going to kill her. But I always tell her, stop stretching your freaking hamstrings. Stop stretching your lower back. Have you been in pain lately? She's like, I've been in pain for the past 20 years. All right, let's do something else. Let's tighten everything. She goes, tightness, that's going to make it worse. Let's see. So this cluneal nerve, even though we slacked and calmed down the nerve, but she also felt some muscular tension, especially on her lumbar muscles that she was squeezing, even though she wasn't really, but she was lightly contracting the lower back muscles. Sometimes it's best to actually fully contract a muscle rather than constantly stretching them.